Hello mga katribu and welcome to another beautiful episode of PairFect. I'm Francine Marquez.
And I'm Kim Sancha.
Yes, and today we are joined by a beauty specialist who will share with us a new outlook in health, beauty, and non-surgical procedures.
Exactly. And she is fully qualified and certified by the American Academy of Aesthetic Medicine, Associate Fellow of the Philippines Academy of Aesthetic Surgery, Philippine Academy of Aesthetic and Age Management Medicine.
Yes, and do you know Kim that she's also a fitness and nutrition specialist
Oh.
and fitness instructor
Wow.
all around, kaya holistic, no? So let's all welcome the President and CEO of Vine Holistic Medical Aesthetic, Dr. Emehly Sevilla,
Good afternoon.
also known as Doc M by friends and her loyal clients.
Yes.
Hi Doc, how are you? Where are you right now?
Oh, right now, I'm actually in SM, Dasmariñas, Cavite. We have provincial clinics. Aside from Vine Aesthetics, we also have Royal Prince in Batangas and Cavite.
So now that with the quarantine levels have been de-escalated to alert level 1, how are you personally and work-wise?
Well, it's actually getting better now. So since it's level 1, people are going out more. So we are in the malls and we are also not in the malls. So we have branches that is in and out of the mall. But all the same, mas lumalabas na yung mga tao. So that's why I'm seeing people that I haven't seen before for 2 years. Nanunumbalik na po sila. Balik alindog na po tayo.
Yeah, syempre.
Yeah. Gusto ko yan, alindog.
Oo.
Dagdagan natin, alindog at kagandahan.
Oo.
Diba?
Para sa lakwatsahan.
At rampahan. Ngayong alert level 1.
rampahan.
Hindi namin sinasabing rumampa. We're just saying. Alam mo yun?
At galaan. Di ba, Doc? Oo.
Tama.
After 2 years, hindi mo makikita yung friend mo. Syempre naman, beauty, di ba, Doc?
Yes. Kaya dapat, pag nakita-kita kayo, pasabog, may paandar.
Oo,
Diba? Something
okay.
like that.
So may question ka kay Doc.
Siyempre, may tanong ko sa iyo, Doc. So, how did you start in this field? So, this profession, paano ka ba nagsimula?
Yeah, okay. So primarily, I'm a medical doctor.
Oh.
So that's why before I became a medical doctor, I was actually a registered nurse. And then I went straight to becoming a physician. And then I went into specialization called aesthetics, anti-aging, and regenerative medicine. And after that, I went to London to get my diplomate exam. And then I also went to Dubai for my international board examination in American Academy of Aesthetic Medicine. So medyo mahaba-haba ang storya ng how I get here in this specialization. However, ayan. So ang importante, maganda pa rin tayo in the end.
Of course.
Tama.
Yeah.
Doc, may tanong na ako, gaano katagal mo, na-achieve specialization or your certification mo? So, gaano katagal?
Since
I think it takes 15 years.
Oh, diba?
to
Oh my God.
Yeah, it's kind of like study after study after study. But being doctors, kasi in our profession, it's always like going up the ladder. So you always continue to better yourself for your patients. So you keep on learning, innovating, and you keep on doing that.
Absolutely.
And then, Doc M, so when did you actually start the Vine holistic medical aesthetic? When did it start?
Yes,
And,
so
why the
Vine
name Vine Holistic
Aesthetic.
Medical Aesthetic?
Yes, or for short, Vine Aesthetics.
Okay.
Ayan, para mas mabilis. We actually started this year 2013, but I actually started my practice 2009. So that was like more than 10 years ago. So I have made a lot of other commercial clinics before I actually came into Vine Holistic Medical Aesthetics. And we started in Makati, Buendia. So after 1 year in Makati, Buendia, we actually transferred to Bonifacio Global City Taguig, which we are until now. So we are coming into our 8 years. Sorry, 9 years na pala kasi
Wow.
2022 na tayo ngayon. So we're
Yes.
coming into our 9th year of Vine Aesthetics. And we have another branch, the SM Mega Mall branch. It's actually our first ever mall branch because this is, could you imagine how funny it is? So we've been here in the business for 8 years and only last year lang kami nagkaroon ng mall. So it's really a blessing from God.
Okay.
Any special reason, Doc, bakit you're not in a mall? Or is it more like because you think of it as a clinic or any reason for the locations?
Well, because before pandemic, we were pegging on a more private location. So we were in hotel, we were in resorts, we were in recreation areas, and a little bit of more on privacy kasi. So this year, for some reason, last year pala, 2021, the opportunity came to us. So of course, you can't say no to an opportunity.
Of course.
So it's a good opportunity. So we took it.
Grab it.
Grab it.
Tama.
Okay,
Ayan.
so-
Sorry. Doc M, of course, we all know that businesses or the business establishment were affected by the pandemic, not just the beauty and wellness industry. So may we know paano kayo nag-cope up? Siyempre, ang hirap niyan, di ba?
Yes, actually, if we would go by the stories one by one, it's really hard, and everybody went through a lot. And then, March 2020, we went into a lockdown. So we were locked down for 6 months actually. So within the 6 months time, I, as a doctor, I was also locked down during the March pandemic lockdown, the first one. And then after 1 to 2 months of it, I went out and actually started helping the crisis because of course I'm a medical doctor, so I actually ventured into more of treating COVID patients and then went into the COVID testing things, and when I was going through this, giving help to people who needs it, and also giving help to people who, establishments like, for example, militaries and then hospitals who doesn't, if you remember, they didn't have like enough gloves, medical
Yes.
supplies, they don't have masks and everything. I actually help coordinate the Camp Krame under the NGOs. I help send out mga supplies to the hospital. So there were a lot of activities going on. So normally I was really not locked in. And then we saw an opportunity. I saw an opportunity in helping the company go into another kind of innovation, which is the COVID testing, COVID patients. So I brought the nurses and our staffs in to whatever I'm doing, and also the diagnostics and everything. So there, from there, we were able to survive actually.
Okay, that's
Pero,
good to hear.
Yeah, but what an inspiring story, Doc, no? When the lockdown happened, syempre, the natural instinct would be to think of what's going to happen next to
Yes.
the business, the clinic. But then, as you mentioned, you helped out and reached out to the frontliners and to everybody else who needed to be helped to mitigate COVID-19.
Yes, agree.
And then from there, dun yun na-imagine yung business. So, would you say that when the pandemic happened, the first thing that came to your mind was to reach out and
Yes,
help others?
actually.
Yun yung nakita ko eh.
Yes, because it's a call of my profession.
Yes, exactly.
Primarily, you always learn about, it's always not about the money. I mean, one thing that I learned, the first thing that I've learned is it's not all about money. And what I thought about, it's not to actually survive the business, it's more of the people. So that's what my heart was, to help the people actually survive. So it's not only the people that I'm concerned with, but also all of the community, because in my heart, this is what I'm called for, doctor. So it's in my blood, it's in my veins.
Ayan. And sorry, Doc. Actually, I was about to say that a few minutes ago. It is somehow related naman sa work mo. So it's a good thing and it's a blessing for them that you helped them during the pandemic. You know, during the lockdown, you said 6 months you were closed, and then it's actually a good thing. Thank you
Yes.
for that.
Pero Doc, hindi nyo ba nami-miss yung mga, kasi we just saw the footages, yung parang when you say about aesthetics, it's all about the glamour,
Yes.
the beauty, the celebrities.
Yes.
How did you reckon with that? Na after that lockdown, you have to be essential.
Mm-hmm.
Well, primarily I was practicing more of not this one before I came into, because just as sort of like a background, I came from a Christian family, and then when I was in the church, I was serving as a missionary. So I go to places where there are, how do you call this, like medical missions before. But when I was not a nurse before yet, I go into, I don't know if you remember these crusades, so the poorest of the poor.
Aye.
So we go, I go with the church to go missions. Okay, we reach out to people, and then, well, if you would have seen my profile, I was a singer, so I was singing in the church before, and then we would do like missionary works, and then I go with the church to sing, and then to reach out to a lot of people, like giving chinelas, feeding people and stuff. So it's not really like a lot of the times that I was a human being, I was in glamour and I was in fashion. So it was not like that. I started reaching out to people when I was younger. And then when I became a when I became a nurse pala, I went into medical missions. And then when I became a doctor, I went into like yung, di ba, mga operation tule, yung mga ganon.
Okay. Oplan, yung mga
Service
ganyan.
talaga.
So yun, tumutulong ako sa sa mga operation tule, medical missions, and I really love it. Part of my life is really growing inside the church. So it's more of like helping others. So it was almost like automatic for me. It's like when God calls you to do something, just respond to it, no questions asked, diba?
Yeah, ang ganda ng thought and something admirable about Dr. M.
Yes.
Oh, that's Dr. M. Now that we're 2 years into the pandemic, I'm sure there are a lot of changes that you incorporated also in your clinic. Ano ba yon, Doc?
Okay, so we have to follow, of course, safety protocols. So ganun para naman, as we all know, we really have to follow the safety protocols, and we are so strict about it. So before, the UV sterilization was only done in the operating rooms. But now we have to do it like every time the patient comes in the clinic, we have to provide the UV sterilization before we actually admit patients in. And also before we take them in, we have to really check like health checklist. Are you sick? Do you have like a simple cold or cough, fever, anything that if you don't feel fine, even for the staffs, our rule is don't go to work, don't go outside. So health first talaga. Safety first is our priority. And then inside the clinic also, of course, we do the disinfection. We're very strict with fogging, UV sterilization, and then alcoholization, everything. So as well as I have to ask the staff or the clinic to stop using humidifiers, and then we stop using yung mga pampabango sa clinic, how do you call it, incense, something like that. And then we also place barriers and all that. So as well as kailangan magpa-test, mga ganung bagay. So dapat may regular testing and everything. We really follow safety protocols as into to the dot.
So would you say the same pa rin yung experience when you go to Vine Aesthetics? I mean, you're still following, of course, the
until now, yes, we are
in level 1.
Yes, in fact, you see our photos are still looking like aliens. We're still wearing those.
Yun.
Yeah, and mabuti naman at you follow the protocols natin. Mahirap nang ma-award.
Oo, ibang
Actually,
klaseng
it's
award.
very, very important kasi we're really close to the patients,
Yes.
di ba? If you've experienced our televiewers and you guys, if you go to a clinic, talagang medyo close encounter talaga ang doctors, mga staffs, and with the patients. So, we still wear our face shields even though whatever level is, kahit na sabihin na hindi na kailangan mag-wear, we still wear our PPEs, we still wear our foot socks, we still wear our gloves, and our face shield. It's still there. You will see us like only our eyes are exposed.
Yeah. And yes, tama naman yan since you are in the medical field, so we need to be a good example. You need to set an example to our katribo, di ba? And our conversation with the CEO of Vine Aesthetic is getting exciting. So, but for now, we'll pause for a break. PairFect will be back after these reminders.
Mga katribu, tara na't makiisa at matuto sa mga public service programs hatid ng Kalingang Katribu. Tuwing Lunes, nandyan ang usapang business na magbibigay tips at inspirasyon sa mga aspiring entrepreneurs kasama si Vernon Velasco. Tuwing Miyerkules, usapang pangkalusugan naman ang tatalakayin ni Miss Cory Quirino sa Health and Wellness. At tuwing Biyernes naman, kung legal advice ang kailangan mo, sagot ka na ng Legal Diaries kasama si Elmer Navarro Manuel at mga guest lawyers. Lahat ng niya mapapanood tuwing alas 3:30 ng hapon sa Daily Tribune Facebook page at Tribune Now on YouTube. Be updated sa news and happenings katribu. Hatid ng Daily Tribune sa inyo ang mga balitang napapanahon sa loob at labas ng bansa. Kami na ang bahala sa paghahatid sa inyo ng mga latest and reliable news. We got you covered sa programang Tribune News on Q. Mapapanood mula umaga hanggang gabi, Lunes hanggang Biyernes sa Daily Tribune Facebook page at Tribune Now on YouTube. Mapalutong bahay man o sumptuous meal for special occasions, sagot na kayo ng tropang Kalanpag. Dahil atid sa inyo ng Daily Tribune ang fun and exciting cooking show na Kalanpag, manood at matuto kung paano lutuin ang mga favorite nyong recipes. Sabayan pa ng fun and inspiring na kwentuhan sa kusina. I-upgrade na rin natin ang mga nakasanayang traditional dish ng pamilya. Plus, healthy tipid tips na ibabahagi ng tropang Kalanpag. Matuto, mabusog at good vibes dito lang sa Kalanpag. Tuwing Lunes, 10:30 a.m. sa Daily Tribune Facebook page at Tribune Now on YouTube.
Welcome back to PairFect. And still with us is the President and CEO of Vine Aesthetic, Dr. M. Sevilla.
Hello, Dr. M.
Hello,
Hello.
welcome back. Okay, so to continue our exciting and interesting discussion with you, so Doc, pwede ba naming malaman ano yung challenging experience or challenging part in your profession, and how about the rewarding experience sa field mo?
Okay, so for this profession, it's all about beauty, it's all about details, it's all about making people look good, diba? So the challenge is usually the demands of the patients and then what are their expectations. So normally kasi when a patient walks into the clinic and then they ask you like, can I make my nose better or make my skin better. Sometimes they don't translate exactly what they like. Parang naiisip lang nila, picture of their head, but then they don't really, can't translate it in words kung ano talaga yung gusto nila. So sometimes I use things like photos, like, do you have a picture of what you really like? Or explain to them or assess them, make time to listen to the patients, ano ba talaga yung gusto nila. Sometimes kasi they say that this is what they want, but when you try to have a conversation, a deeper conversation with them, iba pala yung gusto nila talaga. So it's more of those things. It's more of like expectations versus the reality. Aside from that, another really, really hard thing, and you will agree with me on this, is the budget. So sometimes,
Yes.
right? Like, I really, really like this, but oh my God, it's expensive pala. So
Yes.
it's budget that is kind of sometimes really, I know, parang barrier talaga. But then what we do is we tailor fit our services, and we have made Vine Aesthetics how do you call this, economically feasible for the people. So I call it the beauty journey. So sometimes we do installment services. We do like a beauty journey prioritization kasi minsan iniisip mo na parang gusto ko agad-agad eh. That's the reason why there's surgical and there's non-surgical. So if you're familiar with the surgical, you cut the patient, you sew the patient, but then the results are instant, but there is a lot of downtime. However, when you say non-surgical, which is my practice, that's kind of like you have to wait for the results. So kung medyo matyaga ka, you don't have enough budget, then you could just do it like little by little, like a beauty journey. And then, for example, you do it like, let's say, okay, 2 months, 3 months, 6 months, 1 year. Kung ano yung goal na gusto mo, we will help you get there. But then don't expect na asap na yon agad-agad. Parang ganun. You have to work with us.
Yes, it's all trust the process, sabi nga nila, no?
And super agree kami dyan, yes, yung budget naman talaga.
Yeah. Pero,
Budget-friendly po kami.
Okay.
In fact, as I told you, we have provincial clinics which are more budget-friendly. The brand that we are carrying in the provinces is called Royal Prince. And actually, I'm here right now. We have in Lemery, Batangas, Central Mall. We have in Balayan, Subu, Batangas. And we also have SM Lipa, Batangas.
Doc Em, I want to find out, what's your personal beauty mantra and how do you apply it to your everyday life?
Routine.
Okay, so I'm a very detail-oriented person. And even when I was little, I was fashionable. Maarte na ako.
Gusto ko yan, maarte. Dapat lang, no? Because if in your field, it requires ka-artihan. So, tama lang naman.
Yes, and I remember before there was this term that, ayan, mahuhuli na ako sa age ko. There was this term that they use, pag-girl ka naman eh. Pag-girl So, medyo may ka-artehan na talaga ako bata pa lang. So, this one actually, it kind of translated to my practice right now because it seems like my passion is beauty talaga. So, I found that out when I was looking for a specialization that I can live with for the rest of my life. Kasi as a doctor, you have to make sure na when you go into a specialty, you will be able to love it for the rest of your life. Kasi kung hindi, you will change your specialization. But then, when I went to the specialization, could you imagine I went to surgery, OB, pedia, IM, internal medicine, emergency medicine. I went to that, Opta, sa eyes, and then ears, nose and mouth, ENT. But then, everything like, parang passing by, hindi ko siya masyadong nagustuhan. But when I went into aesthetics, I really loved it and I really embraced it. Kaya hanggang ngayon, nandito pa rin ako. So this is like part of my personality talaga.
Doc, you said that you like making people beautiful also. What about patients na who come in, walang self-confidence? What do you usually tell them na, Doc, mapapaganda mo ba ako or something like that? What do you tell them?
Yung to boost.
Yeah.
Yes, I get that. In fact, nakakatuwa kasi minsan parang psychologist, psychiatrist ka na rin.
Of
Ikaw
course,
na.
therapist.
Oo.
Oo, kasi really, it's part of when you don't look good, you actually feel bad about
Mm-mm.
yourself. Medyo mababa yung self-confidence mo, self-esteem.
Self-esteem.
And you really have to build that as well. Kasi
To
sometimes,
boost.
pag mababa yung self-esteem mo and self-confidence mo, kahit na bumanda ka na, you can't
Hindi pa
see
rin.
it.
Oo, agree.
Hindi mo rin makita. Parang other people would be
I
telling
agree.
you, uy, gumanda na yung skin mo, uy, bumabaw na yung mga scars mo. But then, yung scar mo sa heart yung scar mo sa loob, yung pagkatao, yun yung parang
Agree.
hindi mo. So, every time you see yourself in the mirror, you kind of like, I don't see the difference. It's like, I'm not still satisfied. So, pag mga ganun, pinoproseso ko din sila emotionally, mentally, pinoprocess ko din yung mga patients. So far naman, that's why we launched the 2021, we actually launched the campaign Beauty Speaks. Because with beauty kasi, it's more of deep eh. I mean, there you say that shallow naman beauty, vain lang yan. Pero actually, if you go deeper with the stories that we have, as I go through this specialization for the last 10 years of my life, nakakatuwa kasi there are marriages that has been empowered, renewed, just because the lady or the woman, yung wife, nagpaganda. So si mister, hindi na nagloko. Mga ganun bagay.
Okay.
Another thing is stories like teenagers, it's very big deal for them to have pimples. And then when they get pimples, their self-esteem like really, really low. So nung gumanda, umayos yung skin, naging mabuti, their parents would tell me na, ay, Doc, grabe, nag-excel na yan sa sa school. Hindi na siya nahihiya. Ano na yan, makapal ng mukha. Ganon. Sobrang na siya, okay na siya. So even the grades actually, they go up with, when you not only treat the outward appearance, but you also kind of treat the inner problem of the person.
Naku, Doc, tamang-tama yung sinasabi nyo kasi March is Women's Month, di ba?
Tama.
So parang we really need, with all the stereotypes that society has placed on us, marami din concepts ng beauty. But the most important thing, I think, is what you're doing. It's all about empowering yourself to believe that you're beautiful also inside as well as outside. To probably may mga flaws tayo, but it can be helped through Vine Aesthetics.
That's true.
Okay. And Doc M, syempre, nasa pandemic pa rin tayo. I've said earlier na maraming business yung apektuhan. So, meron ka ba mga plans para, dagdagan ba yung service or to innovate the business?
Actually, as of now, we're good. Okay. These services kasi that we have is really something that is, it's not only like for outward appearance. It actually touches life. So
Okay.
not just
Good.
being in the pandemic, like the things that we do, that how we can help during the pandemic, but also our services is actually helping people recover themselves in the pandemic. Kasi a lot of people actually talagang bumaba yung self-confidence, yung self-esteem.
Yes.
And a lot of people actually are having struggles with finding themselves again. And we're helping people that whenever because a lot of us lost jobs, di ba?
Yes.
Marami ng trabaho. Maraming na-degrade dun sa dati nilang position. Maraming tao na parang they feel like their self-worth is not anymore. Parang hindi na ganun. So, when they start doing this, it kind of like empowers them na parang hindi, kaya ko to. Ang ganda ko. Char!
Yeah, kahit pandemic, dapat maganda tayo in and out.
Diba? Pero Doc, kasi the pandemic was all about essential, survival lang muna tayo. So how can you convince clients right now or those who want to take care of their skincare? How essential is skincare after all?
Well, primarily, when you were going through the pandemic, you will not really think about yourself pa. Parang, medyo ligaw pa yung utak mo eh. You're trying to adjust with the situation, with the world, what's happening, things like that. So, wala pa yan. Oo. But after like 1 year, you feel like, shucks, ang bumpy na ng ng face ko. Ay, ang dami ko ng pimples because of the mask, di ba? And then, start feeling, ay, naku, tumutubo na yung mga buko sa kilikili, kung saan-saan.
Oo, yung mga realities of life.
That you cannot prevent from
realities of
growing,
nature.
from escaping from within, like that.
Oo, diba? Kasi ulo isipin mo pandemic, tapos next
Oo. Why do I need to care for those stuff or for those things? It's
you're-
pandemic, right?
You're
Something
afraid
like that.
of the
Yeah.
virus.
And, Doc, ito lang tanong parang a future question or future opinion from you. So how do you see the future, say 5 or 10 years from now, the future of the wine aesthetic?
Or maybe 1 year from now.
1 year from now, pwede. Or
Marami agad
6
na yun.
months or 2 months from now, pwede, di ba?
Ang beauty queen yung tanong ni Sir. Talagang 10 years from now.
Ayan, speaking of beauty queen, ayan, panahon na nga actually ng pageant, so baka may mga kliyente ka na niyan.
Oo, Doc.
Pageant season na, I'm telling you, I'm serious about it.
Doc, si Kim ang aming beauty pageant specialist na taga-sulat ng mga beauty pageant.
Yan. So go ahead, Doc.
What is the
Ayun.
future
So,
of wine
well,
aesthetics?
if you would ask me 1 year from now, it's all about survival pa rin talaga. Consistency and surviving within the situation that we're in, because we're not yet out of the pandemic, so we still have to struggle, we still have to go through in and outs of it. So it's more of like surviving muna talaga. And then if you would ask me 10 years from now, the vision is really going globally. So before the pandemic, we were in our hearts, the vision is more of like going international. And also not only that, being a Filipino brand, being a Filipino doctor, it's more of like letting other people see that we're world class. Parang 'di ba sa Bangkok, Thailand, sa Japan, 'di ba? Sa Korea, 'di ba? We are also Asians, but and we are also known to have good doctors here in the Philippines. Even when I went to Bangkok in Yanhi Hospital, the vice president of Yanhi Hospital is actually a Filipino.
Wow.
And he actually finished his school in Cebu Medical School. You know, he went to Cebu, ganyan. And I was surprised that he is Yanhi Hospital, by the way, is one of the biggest tourism aesthetic hospital in Bangkok, Thailand. And could you imagine, the owner of it is actually a local who studied in Cebu, di ba?
Wow.
So, nakakaloka. Sabi ko, could you imagine all of the staffs were mostly Filipinos. It's because the owner is actually coming from Cebu, studied in Cebu, and then he went to his country and then made this Yanhi Hospital really like globally. So he told me like, why don't we have a dream like this? Why don't we do this in the Philippines, diba? And actually that still impresses me until now.
Wow. So, Doc we'd like to hear more about you, but syempre, nag-warm up pa lang tayo dito, di ba? Kumbaga, nasa moisturizer pa lang tayo, wala pang makeup.
Yes.
So, we'll be pausing for a break, and PairFect will be back.
This public service advisory is brought to you by Daily Tribune and 100.3 RJFM.
Oh, vaccination, isolation. Gotta keep up with my nutrition. Gotta maintain my body condition. Then I can take my vaccination. What do I choose? What do I take? As long as it is not a fake. AstraZeneca, Moderna, BioNTech, even Sinovac, okay na. Pababakuna ka ba? 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 Vaccination for the nation, no more isolation. With vaccination
This public service advisory is brought to you by Daily Tribune and 100.3 RJFM. Ang Daily Tribune may digital shows na din. Dahil sa mas lumalaki at mas lumalakas nating tribu, handog sa inyo ng Daily Tribune ang mga programang magbibigay buhay araw-araw. Be informed at mag-good vibes tuwing umaga sa programang Gising Na. Be updated sa news and happenings sa Tribune News on Q. Mas kilalanin pa natin ang mga paborito nyong atleta sa programang The Athletes Tribune. Alamin ang latest entertainment sa programang What's Up. Ma-inspire sa mga kwentong hatid ng PairFect. Search lang ang Daily Tribune sa inyong Facebook at Tribune Now on YouTube. See you there mga katribu! Be updated sa news and happenings katribu. Hatid ng Daily Tribune sa inyo ang mga balitang napapanahon sa loob at labas ng bansa. Kami na ang bahala sa paghahatid sa inyo ng mga latest and reliable news. We got you covered sa programang Tribune News on Q. Mapapanood mula umaga hanggang gabi, Lunes hanggang Biyernes sa Daily Tribune Facebook page at Tribune Now on YouTube.
Welcome back to PairFect. I'm Francine and I'm with the fabulous Sancha. And we're still talking to the amazing Dr.
And
Emehly
beautiful.
Sevilla. Yes, Dr. Emehly Sevilla of Vine Aesthetics. Hi, Doc. Welcome back.
Oh, again.
Yes.
Ready ka na bang ma-torture sa ating next
right
segment?
Now we come to the most exciting part of the show.
You should be ready.
Yeah. Where we'll be playing Fast Talk naman, where we ask you certain questions and you have to answer as rapidly as possible.
Yan. So, pinapressure ka na namin, Doc. Let's see kung gaano yung grace mo under pressure.
Ayun. Sige. Ano ba yan? Beauty pageant na naman ang ating peg.
Kasi beauty siya, so related din naman. Di ba? Ito na. Ready? First question. So, first person that comes to mind when you hear beautiful.
God.
Perfect.
Okay. Second question. What makes a woman attractive?
Eyes.
And what makes a man attractive?
Brain.
Oh,
Ay.
agree.
Agree din ako dyan. Agree ako
Agree
dyan.
kami dyan.
Pareho tayo. Galing na pareho tayo.
Oo.
Promise, I'm sorry, Doc. Minsan I don't look on the looks of God.
Pero it only says great
Brain.
minds think alike, di ba? Pareho tayo ni Doc. Okay.
Ayun lang. Sorry. Anyway,
naman.
do you follow a certain bedtime routine?
Oo, you're...
Yes.
Okay.
Which is...
Ano yun?
I spray perfume before I go to sleep.
Wow!
Ganda. Gusto ko
Kakaiba to.
yan. Oo.
Okay.
Ito naman, aside from knowing that, your biggest beauty secret.
Ayan na. Hindi na siya secret. I-reveal mo na siya eh.
Beauty comes from within, so it's really hard.
Ah. Confidently beautiful with the heart. Oh, beauty queen na naman.
Malapit na ha. Nasa ano na to? Semi-finalist
Oh,
na
top
talaga
5
si
ka
Doc.
na. Top 5 ka na.
Top 5 ka na, Doc, sa mga sagot mo. Okay.
Tingnan natin kung abot ka ng top 3 ha. Okay,
sige,
next
ikaw
question. What would you tell your 21-year-old self? Mahirap ah.
Hold on.
Diba? Perfect ang sagot, di ba?
Yes.
Ayan, dahil dyan pasukan sa top 3.
Nakaka-nervyos na. Oo. At
Patasan tension.
Yes.
okay, Doc. Bago kayo ano ba yung umiikot?
Oo, yung turn niya.
Turn.
Oo.
Oo. Ito naman, question. Your beauty motto.
Beauty is in the eyes of the beholder.
Oh, tingnan mo, sagot niya ni Rupa sa Miss World 1993. Beauty queen ka ba? I remember that!
Yeah.
She said that.
And look at what happened to Rufa. Nanalo, di ba?
Second princess.
Second princess. Okay, ikaw naman.
Oh, yan, next. Nasa bayan na wala, tuloy ako bila. Okay, beauty or power? Mahirap to ah.
Yeah. Okay, beauty. Because when you have beauty, you have power.
Tama.
Wow.
Or pwede din the other way around actually.
Actually, oo.
Yung pinili niya, so go.
Ito naman, most challenging question. Doc M in one word.
Resilient.
Ah,
Ang galing na talaga.
tama. Hindi kasi yung based on interview natin kay
Oo.
Amazed nga ako sa kanya, ang dami niyang film ng
Oo.
doc, ano yan, medical na tiniray mo. Parang,
Oh, top
ikaw
two
na.
top two
Ano na yung final question to determine the Miss Universe.
Kaya ganito yun, yung parang naghaharapan na
Correct, yung magkaganyan, oo.
Ganun
The
na sila.
first, ano,
Maghahawakan
oh, di ba? Ayan,
Ask mo na
actually,
ang
tatlo
question.
tayo. Kayong dalawang matitira.
Samahan mo ako, sumagutin kayo.
Oh, ask mo na ang last question.
Okay, the last question, syempre.
Ganun na si Doc.
Correct. Can you describe in 3 words Vine holistic medical aesthetics?
Budget-friendly beautification.
Ay, branding pa din. May nanalo na talaga, and that's yun. Ang corona. Vin, asan mo yung corona natin dyan? We have a prop crown dyan. Oh my God. And Doc M, thank you so much for your time. We had fun.
Ang beauty queen namin ngayong hapon.
Yes,
ito.
it was exciting, you know,
Yes.
interesting, and you know, caring and touching in a way, you know, because of your ginawa dun sa ating mga frontliners too. So, you know, just moving and touching. Yes, exactly.
Can you imagine? So, Doc M, once again, we thank you for being part of the show. So, syempre, we cannot let you go without giving us more of your inspirational words.
Yes.
Okay, so I just want to invite everyone to Vine Holistic Medical Aesthetics and of course Royal Prince. So Vine Aesthetics is located at Unit 2H, the Grand Hamptons Tower 2, 1st Avenue Corner, 31st Street, BGC Taguig. Malaki ang parking lot sa harap, no problem.
Yes.
And we're also at SM Mega Mall, Mega A. Nasa tapat po kami ng Macau Imperial,
Okay.
Milk Tea. 5th floor po kami. That's right. And we also have Facebook page. Look for Vine Holistic Medical Aesthetics. Our Instagram is Vine Aesthetics. And by the way, guys, pwede ba akong mamigay
Of
ng
course.
libreng treatment today?
Wow!
Sige.
So guys, pakihanap lang po yung picture ko na nakalagay na the beauty doctor. You will see me in pink, okay, gown. And then if you comment below and like that photo, the more comments and the more likes we get, you will be winning photodynamic therapy, facial therapy. It's an instant
Wow.
rejuvenation cleaning.
Ay.
Yung picture ko.
Oh,
Okay.
exciting. Oo, see how generous si Doc
Yes.
M talaga, no?
Diba?
No wonder, beauty queen in our hearts.
Yes.
Yun, oo.
Doc M, it has been a delight speaking with you this afternoon, and we are looking forward for more episodes with you in PairFect.
Yes.
Thank you so much.
Doc. Muna tayo. Yeah, so to our dear Katribus, watch fresh episodes of PairFect every Wednesday at 2 p.m. on the Facebook page of Daily Tribune and on Tribune Now on YouTube.
And once again, I am Kim Sancha,
And I'm Francine Marquez.
and this has been PairFect.
Okay, Kim, let's do this. Bye.